Hello, and welcome to Health ABCs. Today we'll be discussing stroke. Today we're going to talk about what is a stroke, what are the common symptoms of stroke, ways to prevent stroke, treatments for stroke, and where you can find more information about stroke. But first, this talk is created by medical students solely for the purpose of patient education. It is not to be used as medical advice and does not replace seeing your doctor. If you think someone is having a stroke, call 911. So what is a stroke? A stroke is what happens when your brain does not get enough blood supply. There are two main types of stroke, called ischemic and hemorrhagic. I like to think of the brain and its blood supply like a pipe system. The first type of stroke, ischemic, means that there is not enough blood getting to the brain because the pipes are clogged. The second type of stroke, hemorrhagic, means there is a leak in the pipes, causing blood to bleed on or around the brain. Let's dive a little deeper into these two types of stroke. So what is an ischemic stroke? Ischemic stroke is the most common type of stroke. The most common cause of the pipes, aka your blood vessels clogging, is called atherosclerosis. Atherosclerosis is a collection of cholesterol and fat that form a plaque in the blood vessels that feed your brain. If this plaque becomes too large, it can clog the system, leading to less blood feeding your brain. Doctors may call this a thrombus. The plaque may also break off into little pieces that can scatter to other connected blood vessels downstream and block them at the same time, causing what doctors call an embolic stroke. This plaque can be in the blood vessels feeding your brain or even in your heart. For patients with the abnormal heart rhythm called atrial fibrillation, AFib for short, the top of the heart flutters quickly instead of squeezing normally. Because of this abnormal movement, the blood in that part of the heart becomes stagnant and can form a clot. This clot can break off in little pieces that scatter to the blood vessels feeding the brain, causing the embolic type of ischemic stroke. Other causes of ischemic stroke include heart attack, which causes less blood to pump to your brain, and blood clotting disorders, which can cause the blood to clot off the vessels that feed your brain. Another cause of ischemic stroke is drug use, particularly cocaine. Cocaine has many effects on the body, and one of these effects is called vasoconstriction, which is like if the blood vessel wall was squeezed so that there is less space for the blood to travel to the brain. Hemorrhagic stroke is when there is a defect in the blood vessels causing blood to collect on or around the brain. A common cause of hemorrhagic stroke is high blood pressure, aka hypertension. Going back to the pipes again, if there is too much water pressure, it can cause the pipes to burst, spilling water everywhere. This is how high blood pressure can cause a stroke. Too much pressure in the blood vessels causes them to leak, spilling blood into or around the brain. Defects in the blood vessel walls can also increase the risk of hemorrhagic stroke. These defects cause the walls to be weaker, increasing the risk that they will become leaky. One example is an aneurysm. An aneurysm is when part of the vessel wall forms a balloon-like pouch, which is weaker than the normal vessel wall, and can burst, causing a hemorrhagic stroke, especially if the patient also has high blood pressure. Another cause of hemorrhagic stroke is drug use. Here we see cocaine again. Cocaine can increase blood pressure, which causes hemorrhagic strokes. So what are the common symptoms of stroke? The symptoms of stroke can be different for patients depending on what part of the brain the stroke affects. The two main types of stroke can have similar symptoms, but how quickly the symptoms occur can be different. The most common signs that someone may be having a stroke can be remembered as B fast. B for balance, for a new loss of balance. E for eyes, so having blurry vision or trouble seeing. F for face drooping. A for arm or leg weakness that is new. S for slurred speech or troubled speaking, and T for time. Be fast and call 911. If you see someone with any of these symptoms that they never had before, it's time to call 911. The faster someone is brought to the hospital, the better. The treatments for stroke depend on the type of stroke. Ischemic and hemorrhagic strokes are treated very differently. For ischemic strokes, the goal is to get more blood to the brain. If a patient with ischemic stroke is brought to the hospital fast, they may be a candidate for a medication that busts the clot to help restore flow to the brain. Doctors have a list of criteria to make sure the patient is able to safely get this medication because this medication may cause bleeding. Some patients may also qualify for a procedure to go into the blood vessel and remove the clot. Other medications that can help prevent future strokes include aspirin, which helps to prevent future clots from forming, a statin, which helps lower cholesterol to prevent more plaques from forming, and medications to lower blood pressure. Lifestyle changes like stopping smoking and drug use and eating healthier are also ways to prevent a future stroke. If a patient has a hemorrhagic stroke, the goal is to stop the bleeding. This is likely done by a procedure or surgery by a neurosurgeon. Medications to control blood pressure are also extremely important to help control the bleeding and prevent future bleeds. Stopping smoking and drug use can also help prevent future bleeds. Once a patient who has had a stroke is stable to leave the hospital, most will go to a rehab facility to help get them stronger by working with physical and occupational therapists. So, how to prevent a stroke? Prevention from having a stroke is always the best practice. Lifestyle changes like eating healthier, exercise, weight loss, and stopping smoking and drug use are important to prevent the risk of stroke. Even small changes like walking the stairs instead of taking the elevator or replacing fast food with a home cooked meal can keep you active and healthy. Seeing your primary care doctor regularly can also help prevent strokes by making sure you're healthy and helping to control other medical problems you may have that can increase the risk of stroke, like high blood pressure, high cholesterol, abnormal heart rhythms, and diabetes. For more information about stroke, healthy living, and smoking cessation, these are some links from trusted organizations, which will also be listed in the video description below. For other questions, you can ask your doctor.